Hi, my name is Chrissy Reichert, and I'm a student at Indiana State University in the Doctor of Athletic Training program. Today I'm going to be talking to you about my recent stakeholder education project, which revolved around me going to my stakeholder to submit an idea of change or perhaps suggesting a need of improvement somewhere, especially in my athletic training facility and in my practice. As a GA at Indiana State University for women's basketball, my head athletic trainer was my stakeholder. So I did some pondering about, as a new GA, what could have been better, or what hindered my transition. Because after talking with my head athletic trainer, she told me that it takes about a year for a GA to become a new clinician, to really feel comfortable in their practice. And to me, that felt too long, even though that was shorter than most colleges and universities. So I pondered about that. What made my transition so slow? And it came down to two things, if you count the slow transition: my communication and policies and procedures. And I realized that there was a lot that I didn't know, especially as a fall/spring sport. By the time I went through orientation, most of it was forgotten, and I couldn't help but realize that I think it was the orientation that caused the issue. Our orientation is an 8-hour long session where we're sitting on stools and listening to people that we don't really know at the time instruct us on how to be a clinician. And for me, I guess that was just too overwhelming, or too much information in too long of a period. So instead, I decided to perhaps pitch the idea of splitting up orientation into 3 sessions that happen on different days, but consecutively. This way, the student, incoming new GA, will have a better idea of what to expect and a better idea on how to transition into practice. So my 3 sessions were to split it up into 1, looking at the daily practices of an athletic trainer, especially one at Indiana State University. This talked about regular procedures, our EMR, as well as how to be a GA, or what their expectations were of us. My second session revolved around our physicians, looking at which physician was for which body part, since ISU splits it into multiple physicians. Talking about referral process, or how insurance works with that, or what paperwork needs to be done. How does the athlete get there? Who do we send them to? All these things that kind of circle around our healthcare providers as well as our physicians. And this even covers psychosocial as well as general medical, and not just orthopedic. My suggestion for a third session revolved around how to be a preceptor. Last year when I first came in August, and I had a student in October. For me, I was literally just a senior student, and now I have a senior student. So for me, it was a little bit overwhelming. I had no idea how to be a preceptor. I've learned throughout this year, but coming in, what are some things that I could definitely improve on? So I wanted to focus on what even is preceptorship. How do we become a good preceptor? What expectations should we hold? Our perception of preceptorship. What do we feel that we need to do, especially based on our past circumstances or our past student lives or preceptorships? Talking about resources, student handbooks, talking about how to ask for help about our student. All those things I wanted to cover in session 3. So when I came to my supervisor on our meeting, I actually had 2 supervisors, the head athletic trainer and then the assistant athletic trainer. And it started out with a little bump in the road, because about a month or 2 before I even pitched the idea, my stakeholder ended up coming up to me after getting wind of the idea and getting very defensive that I was saying that all the procedures we were already doing was wrong, that orientation was bad, and that was the last thing that I had intended to do. So going into this meeting, I was already on the defense and trying to show her that I wasn't trying to tell her that it was wrong, but yet how to make it better instead. And so the beginning of our meeting started with that. And so telling her that this wasn't an attack, telling her that as a higher education athletic training facility, which employs all DAT students, how do we become better for our facility, for our patients, and for our students, as well as for our university? So once you kind of got that mindset out of the way, the meeting actually progressed rather smoothly. Unfortunately, my entire pitch was not approved, but it is a compromise that we came to, and I'm really happy with the results. She agreed that 3 sessions were going to be better, and that they would be a couple of hours each, maybe 2 hours at the maximum, and focusing on the different categories for each session. However, the last session of preceptorship was not approved, since we do have a preceptor development meeting that occurs the same weekend. Instead, she left that open for other suggestions that we may have, or things that her and the other full-time GAs wanted to discuss with us. But overall, we had a great compromise. She was able to see the pitch, and she was able to really understand where I was coming from and the need. Especially for me, I got back up from the other two GAs that will be returning. Since there's 3 of us returning and 10 new GAs coming in, we need to all be on the same page. So I talked to the other 2 GAs, and they were right on board. And so bringing that to my stakeholder really aided in that process. It was perhaps a 30-minute conversation, but it involved going back and forth between ideas, and I felt that it was very beneficial. After our meeting, I was able to reflect on the effectiveness of that meeting, and it turned out it worked out a lot better than I thought. And for me as a new GA and for me as a new DAT student, it gave me an incredible sense of empowerment that even though my entire plan hadn't been approved, I was able to facilitate change in my work environment. And for me, that was like the first time that's ever happened. And it was such a rush in a way, and I felt that I learned so much from this DAT and that I was able to go to my stakeholder, which before was never even an option. So overall, I was super excited about ending that meeting and having that compromise with my stakeholder, and I look forward to following up. Now, on my follow-up, unfortunately, it won't be happening anytime soon. Orientation will begin in June and July, and so I think it's in July. So it's going to take a little bit, and I'll be doing several small follow-ups with my supervisor before I follow up maybe a month or a couple weeks ahead of time for the session or for the orientation to kind of make sure that we're on the same path. Since my recent follow-up, which was several weeks after the orientation, the third part of the orientation that she kind of left open was hopefully to incorporate the 3 returning GAs and perhaps giving some advice from our personal perspective or things that we wanted to touch on personally. So right now that's kind of up in the air, but it's a great idea for us to get involved and to make our relationships with our new GAs as well as our supervisors better. I think, speaking of relationships with our supervisors, and as I reflect on my experience, I felt that this stakeholder education project happened at the perfect time. My first semester as a GA, I was a little bumpy in the road, obviously becoming from a senior student to a new GA, basically overnight. So I think that had I tried to do this education meeting or perhaps try to elicit change earlier in my GA-ship, I don't think I would have been successful. I started in August, and I had my meeting with my stakeholder in March, and I felt that February-March area, and I felt that it really was the perfect time. I had all those months, all that time to really gain a relationship with my stakeholder as well as prove myself as a clinician and as a professional. And so going in, she came in with a better air of, okay, maybe she has something that's really important to talk about, like I've seen her work. And so we had a better relationship for the foundation, and I felt that very much enhanced and was a pro of our conversation. I think additionally, although we had that bump in the road at the very beginning, where she came to me months before my pitch, at first I saw that as a bump in the road, and I still feel that it was a minor setback, but it helped facilitate the conversation to happen sooner. So she was like, let's follow up with this immediately, and I wanted to make sure that she knew that it was not an attack, it was not saying that this was bad, it was just how to make it better. And so it facilitated the communication to happen sooner, and it provided a foundation to go, hey, I know what you're thinking. I think for this, though, one of the main improvements that I could do is to don't go in assuming what she knew, because I did. I came in going, she doesn't want this, she thinks it's bad, she told me this herself. But maybe facilitating my next pitch or my next time I want to facilitate change and going, hey, like, what is your opinion on this? Like, getting her opinion without going, this needs to change. So I think that's one improvement that could definitely happen. Going in, so the demeanor and the attitude of the room started out a little bit tense, but then it improved. And I feel that again, helped with the communication and becoming able to compromise. I decided to go with her one-on-one, though, because she's a one-on-one person. having a big group of people with everyone jutting in opinions is just a little overwhelming for both of us. So going in one-on-one was the perfect way to get this communication done. Unfortunately, I think that near the end of the conversation, the first two were good suggestions for the first two sessions, and then when it came to the preceptorship, she lost interest, and I'm not sure whether that's because of the preceptor development meeting that would be happening the same weekend, or if it was just the end of the meeting and she was like, okay, you've facilitated enough change. So I think maybe changing that last session from preceptorship or involving Dr. Gavin and Dr. Armstrong into saying that this is a need. That would be a great improvement. So I could bring it back to my stakeholder and say, listen, I talked to the two people that do preceptor development meetings, and they agreed that this is something that we should touch on in orientation to help to just reinforce preceptorship and GA-ships to everybody that comes in that's new. I think my last improvement or correction is just to have that communication a little bit sooner. Although the beginning, when she came to me before the pitch was done, although it did facilitate a quick communication, I felt that perhaps I'd come to her before rumors started flying and she felt defensive, that perhaps we could have avoided that entire conflict together. And although it did turn out great in the end, I think that that's a way that it can be improved, not necessarily taken out or corrected altogether, but just something that in the future, maybe just going ahead and when I'm ready and when this plan is solid, just delivering that and not being scared or apprehensive about how it's going to be received. But again, overall, I'm thrilled with how it turned out. I look forward to following up with her. I just felt so empowered, and I'm ready to facilitate more change. And this was just the beginning. So as I reflect on this experience, I'm thankful for the DAT. I'm thankful for all the things that I learned this semester to be able to be a forefront of athletic training, to be one of those athletic trainers that causes change. And it's helped me be a leader. Again, this was just the beginning, but I'm looking forward to how it turns out.